All right, Dr. Mike Oakley is here because we're talking about, in case you haven't heard, Massena, who has one of the robotic machines that you have over at CHMC. They are phasing theirs out, which then leaves you in Ogdensburg with the only robot doing surgery. For those who don't know, with this robot, what surgeries do you do with it?
Certainly, yeah. Massena announced yesterday that they were going to phase out their robotics program due to some financial concerns. It's an unfortunate loss for the community there. What we do with our robot here is a lot of general surgery work as a surgeon. We do colon cancer operations, hernia work, any laparoscopic surgery that could be done before. We're using the robot, which has certain key advantages. Definitely the recovery times are shorter. I think for me, the biggest advantage is really the reduction in narcotics. I mean, you look around, everyone knows somebody with a, opioid problem. And a lot of that has to, falls on doctors. After surgery, people got a lot of narcotics over the years. And this is a device that has really helped me overnight to change my practice. The vast majority of my patients are now going home without any need for narcotics, which is huge. I
mean, there's a big difference in just recovery time, robot versus traditional laparoscopy.
Yeah, so for certain operations, it's a pretty similar deal for removing a gallbladder surgery or something like that. There are some advantages to the visualization and the imaging the robot has. But the real game-changing operations are things like hernia work. The hernia repairs that we're doing are pretty state-of-the-art. And this is not something that can be done easily laparoscopically in any major place. I think the colon cancer operations that we're doing with being able to reconnect everything right inside the abdomen really helps people get out of the hospital faster. We average about 3 days in the hospital. The vast majority of my patients are going home comfortable with just Tylenol and ibuprofen, which is not something we could have said 2 years ago before bringing the robot here.
Now, to have a robot is not cheap. There's a lot of expense that goes along with this on your end.
Absolutely. The hospital has made a major investment both in training the staff as well as keeping the equipment up. And luckily at Claxton, we've had the volumes to make it a profitable thing. And I think as a dedication to the community, we all know this is a good piece of technology. People benefit from it. I mean, that's not hard to sell. But, there is no extra reimbursement from insurance companies for doing a robotic surgery. So the patient doesn't get billed anything extra. So yeah, there is, some cost analysis that we analyze every month. And, due to our high volumes, we're able to keep it here, which is nice. And we're dedicated to doing that for the community.
So as far as surgeries go, hernia, colon cancer, gallbladders, What else?
As a general surgeon, those are kind of my specialties. Also, the GYN doctors at Claxton are using it for hysterectomies and ovary procedures, things like that. In the next year or so, we're hoping to kind of work towards a urology program and growing what we already offer.
Okay, so if that's a condition that you've got that you want to take the robotic option versus traditional option, how do we get more info and get in touch and all that?
Certainly. I think anybody interested in robotic surgery in general can go to the hospital website, Claxton Hepburn, and there's a /robotics. That's a great place, or the St. Lawrence Surgery website. There's also some information on robotic surgery. And, all surgeries are different. Every patient's unique. So it's not a one-size-fits-all thing. But if this is an option for you and your surgeon is comfortable with it, I think that it's a really nice approach, and it's certainly something you should consider and talk with your doctors about and see if it's right for you.
All right, thanks for coming in today.
Appreciate it.